So in this video, we're going to talk a little bit more about PCOS, Polycystic Ovarian Syndrome, what it is, why it plagues so many women, and just try to provide some information so you can understand more about what's going on with your body. A lot of times when these cysts are developing on the ovaries, we know there's a hormonal component. We know there's a structural component. We don't necessarily understand why it affects the women it affects, but there's so many factors around it, and there's very limited research. Of the research that is done, we do know that even just in women ages 20 to 30, it's affecting 5 to 6 million women in the US. And that's so underreported, you guys. So all of that to say, it's a big problem that affects a ton of women. And so I really ask that you would share this information out, because there are some answers and there are some hope. So as these cysts develop in and around the ovaries, a lot of times treatment is hormonal, which can have other side effects and possible risks and consequences. But bringing the hormones back into balance, which really should start at a nutritional and gut health level. So I definitely encourage you to look into that, maybe get some blood work done, get those levels checked, talk about it with a nutritionist, a naturopath, possibly your OB, especially if they're very wellness minded and holistic. And then from a structural standpoint, there's even fibroids too, which can sometimes be separate from this. So there's a lot of different issues, but with the structural therapy, we can really help to address the inflammation and adhesions that contribute to the body kind of clustering off these areas. And there's just a lot of inflammation, pain that causes swelling and bloating, can be extremely uncomfortable, can definitely impair fertility, and have a very negative impact on a woman's cycle. So just trying to share some information about what you can do about it, and we're going to address some more specific solutions in our next video.